Good morning everybody and welcome to our COVID Business Support webinar aimed to support those of you here today who are offering beauty treatment and nail services. Our webinars are aimed at directly tackling the regulations and close contact government guidance. We were so pleased to hear about the announcement relating to the reopening of salons within the beauty sector, and we really hope that you are settling back into being able to work again. Today, we will offer you the support and advice you will need in order to comply with the requirements to operate safely during the pandemic. The role of the City Council in response to the pandemic is to investigate workplace outbreaks, to work with other partners such as Public Health and West Midlands Police, and engaging and advising with both yourselves and members of the public. We launched our new COVID Business Support team back in September, which is made up of professional officers and our COVID support advisors. Our responsibilities in the team are to offer you that support that you need, to guide you and to regulate where needed through using our enforcement powers. We have a panel of experts here today, including myself, Charlotte Rose. I'm the service lead in the COVID Business Support team. I'm an environmental health officer by profession, and I have a vast amount of experience in infection control in relation to the beauty, cosmetic and tattooing sectors. I'm personally campaigning for better regulation in the industry, and I'm pleased to be here today to work with you to assist you during such uncertain times. I'm now going to introduce you to my colleague Ravi from Public Health.
Hi, I'm Ravi and I work in Public Health as a commissioning officer.
Thank you, Ravi. Today, we are encouraging you to ask questions of us, particularly around any uncertainties that you may have. You may have already submitted questions to us, and if you use the online tool here today, to the top right-hand side of the screen, you can submit questions of us, and we will answer those towards the end of the session. You will also receive an FAQ document within the next 7 days with a copy of those questions and answers. I'm now going to hand over to you, Ravi. Thank you.
Thank you, Charlotte. So what is COVID? And I'm sure that we're all familiar with this now. We've been listening to nothing else in the media, but I just wanted the opportunity to emphasise that it spreads through droplets in the air when a person coughs, sneezes or speaks. You can become infected through touching contaminated surfaces and then touching your face, then you're touching your eyes, nose, mouth before washing your hands. So the longer or close to a person you are, the more likely you are to contract the virus. We know that people are tired of this and there's a fatigue that's kicked in, but our plea to you all is that we've done so well and that we just need to continue, because there is light at the end of the tunnel. There's a vaccination, but there is still a lot to do regarding the rollout of this. So it's not the time to relax the measures. So the public health measures continue to be really important in terms of washing your hands, using a mask and social distancing, because what we have learned is this virus is very infectious and it hasn't gone away. So the next slide shows a number of positive test results in Wolverhampton. So you can see that following the first wave, cases were very low in July. We literally had 1 to 2 cases a day. However, in September, cases slowly started to rise. In October, we can see positive cases started to increase. And you can see at the end of the chart, from the end of November, positive cases have started to decline, which is actually really, really positive. So there's a downward trend and we hope this continues. So the latest data in Wolverhampton shows there's 240 COVID cases per 100,000 people over the past 7 days to the 6th of December. That means approximately 632 people in the city tested positive for the virus in that 7-day period. Thank you, Charlotte.
Thank you, Ravi. A COVID-19 risk assessment, it's not about creating lots of paperwork, but it's about you as the responsible person identifying what work activity or situations within your business might result in the transmission of the virus. You will then identify sensible measures to control those risks in the workplace. Identifying hazards that could cause injury or illness, such as not wearing your PPE, communal areas, contaminated objects or surfaces such as kettles, towels, brushes, cups and pedicure foot spas, and also the elderly and any vulnerable people. The risk is how likely somebody could be harmed or have adverse health effects and how serious this harm is. An example from sharing towels, spatulas or not social distancing. You should manage, review and implement the findings of your risk assessment in line with the close contact guidance. If you are self-employed or you have less than 5 employees, then the requirement to document your risk assessment does not apply. It is imperative that you train your staff on the findings of your risk assessment and to make them aware of any changes as we move through the pandemic. You can download templates from the HSE website and you'll receive a copy of this link within the FAQ document. Track and trace. In all close contact services, whether you're at home, mobile or within a fixed premises, you must display the QR NHS code poster. Please place this in a prominent position at the entrance or at the payment station if you've got a reception area. Should you wish to keep a separate register in addition to the QR NHS code, or for example, to cater for those who do not have access to the application, then simply record their name and contact details, the time and date of treatment, and keep a record of for staff members for close contact purposes. Please ensure that you comply with the GDPR requirements and store those for at least a minimum of 21 days. With regards to keeping your workplace clean, it is important to keep your business premises clean both before, during and as you leave for the end of your working day, especially after all of your customers have vacated the premises. Take a close look at what areas are highly used, touch points, objects and how frequent they should be cleaned. An example would be door handles, taps, sinks and pedicure foot spas. You should disinfect and sanitise these more frequently between client use as people enter and move around the premises and as they have vacated. Equipment and tools should be designated to each staff member and not shared. It is imperative that you remember to clean between uses and allow yourself time to reflect this into your working day. Now, when it comes to social distancing, otherwise referred to as physical distancing, where you keep a safe distance from others, where this isn't possible due to the nature of your work, you must implement risk mitigation. Think about reducing capacity, think about the use of your waiting areas. Could you ask your customers to wait in their cars before their appointment? Or could you ask them to remain outside, socially distancing from others? Distance your stations, place screens where 1 metre or below, have chairs back to back or side to side, and implement posters and floor markings to guide people. But most of all, try to keep your appointments to a minimum. It is imperative due to the close contact nature of your business activity that you wear your PPE, that you clean frequently, and that you increase the level of hand washing. Now, when it comes to your PPE, this should come in the form of a clear visor or clear goggles that should be securely strapped behind the ears or head, and you should wear a type 2 face mask. Now, this face mask is very different from the face coverings that you see that most people are wearing as they're going shopping. It is a medical grade face mask made up of 3-ply construction that prevents large particles from reaching your clients. Due to the skin-to-skin contact, the nature of your work, use single-use gloves and a single-use apron, or you can use a washable apron that can be cleaned down between uses. Clothes that you wear to work that are simply used for work purposes, we advise that you change into these once you arrive on site, remove before you leave, and wash separately on a 60-degree wash as you arrive home. Now you'll hear us going on about hand washing, and I'm sure that you've seen it in the media, especially social media. It really is imperative that you increase the frequency of your hand washing. It is a legal requirement to have a hand wash basin that is designated solely for hand washing, with both hot and cold running water, a supply of soap, preferably liquid format, paper towels or hand dryers. Do not use the reusable towels. And I would also recommend and encourage you to place hand gel stations in and around the premises, particularly at the entrance points, pay area, breakout rooms, toilets and exit points. Other areas to consider within your business are to have staff working bubbles and shift patterns, breakout rooms, look at sporadic breaks, cleaning down touch points such as microwaves, kettles and cups, and to make sure that staff are abiding by social distancing. Smoking shelters should accommodate distancing and not be overcrowded. Between taking your breaks, you should replace single-use PPE and clean down any reusable visors or goggles. Please also remember when you're taking breaks to increase your hand washing. Meetings and training should all be performed online. There are various online applications that you can use to accommodate this, and any work-related travel, you should advise and encourage all staff to comply with face covering requirements, and you should also discourage shared vehicles. Now, with regards to face coverings and your customers, we understand that this has been extremely difficult and challenging for you, but your customers must abide to the requirements unless they are exempt. Should you need assistance with this, please do not hesitate to contact us or West Midlands Police for support. Now, one of the concerning trends that we've seen quite frequently recently, whilst our COVID support advisors have been out and about engaging with businesses, and also our environmental health officers whilst they've been doing their COVID-19 inspections, we've noticed that there are a number of beauty businesses that are carrying out threading using a mouth technique. Please do not use this technique, as there are serious implications, not just including COVID, but other skin infections such as herpes. Due to the close contact proximity to the eyes and mouth during this technique, it is advised that you use a more safe and suitable technique. It presents a whole host of concerns. Please do make contact with us via our email address that will be sent to you afterwards if you do need some advice on this particular technique. And now I'm going to pass you back over to Ravi. Thank you, Ravi.
Thanks, Charlotte. So, if you employ someone who develops symptoms, they are required to get a test and stay at home. If negative, they can return to work. However, if positive, they must stay at home and isolate for 10 days. They can return to work if their clinical symptoms have improved and do not have a temperature. Household members will also need to isolate for 14 days from the person's onset of symptoms. If they had no symptoms, the test date can be used to start the isolation period. I've been supporting workplaces to manage COVID incidences and outbreaks with environmental health colleagues. And since October, we've seen over 100 workplace incidences across the city. This includes transmission occurring between staff. We've seen a very small number in your industry, which is really good because it means that you are complying with guidance and keeping yourselves and your customers safe. We have a recent case, however, where all the workplace staff became infected and over 60 clients had to be contacted as they met the close contact definition. So where there is an incident, you must ensure that a deep clean is done and to be extra vigilant to anyone else developing the symptoms. So the measures that Charlotte has just described are absolutely critical to ensure you're keeping yourselves and your customers safe, particularly given the run up to Christmas. So what do we actually mean by a close contact? The definition we use is a metre a minute or more, and between 1 to 2 metres for more than 15 minutes with a positive case. I have found that Track and Trace haven't been able to notify all contacts, so it's really important that anyone who is positive, their contacts are notified and told to self-isolate for 14 days from the date they last had contact with that positive case. However, I just really want to stress that if you are a close contact and you decide to get a test which is negative, this doesn't mean that you can go back to work. You still must isolate for 14 days. We've seen that many people think it's okay to do this, and it's not, as you still might become symptomatic and spread the virus and also become ill. So you may qualify for financial support if you are self-isolating and unable to work. A payment of £500 could be available through NHS Track and Trace. Also check out local information on the Wolves in Business website. The final slide shows the current testing sites across Wolverhampton. They include Shell Road, Whitmarines Library Car Park, Falkland Street Car Park, Rookery Street Test Centre, Blakenhall Resource Centre and Mountford Lane Car Park. All these need to be pre-booked, however, you can walk up to Falkland Street Car Park and request a test. At the Civic Centre, lateral flow tests are now available, where results can be obtained within an hour for people with no COVID symptoms. This started on Monday and is open from 8 in the morning till 7 in the evening. Thank you for your time and for listening. Over to you, Charlotte.
Thanks for that, Ravi. That was really useful. Thank you. So some of the questions that we've received, we're just going to go through those now. So and please feel free to submit questions today, or you can submit questions afterwards. So do I need to wear both the visor and goggles and a type 2 mask? The answer to that is yes. Your visor or your goggles is actually deemed as PPE. It doesn't cover the visor, or the goggles will not cover the nose and under the chin, which is why it's so important for you to wear your type 2 medical grade mask. It will clip onto the nose and under the chin and strapped behind the ears, and that is so important in terms of preventing that person from spreading it to others. Does the Saturday girl who washes hair have to comply with the PPE requirements and type 2 mask? Yes, because she is carrying out close contact services such as hair washing. If there are Saturday girls that are simply working behind the reception, so taking payments or answering the telephone, then we would strongly advise that that individual works behind a screen, or if she isn't working behind the screen, she will wear a general face covering. If your risk assessment deems that she needs to wear a type 2, then that's what she will need to wear. And it is a legal requirement when working or being in that setting that Saturday girl is still required to wear a face covering, even if she isn't carrying out close contact services. Can I wear reusable washable aprons? Yes, you can, but you need to make sure that you clean and disinfect between clients, the same as your visor and your goggles. Can I use supermarket brand cleaning products? Of course you can. The guidance says that you carry on with your normal everyday environmental cleaning regime. If you do want to look at a specific BSEN product, you should be looking at the back of any product. It should say BSEN 14476. They are slightly more expensive, but you'll be used to following your normal cleaning regime, so just stick with that. That's what we would recommend. If I test negative for COVID after a close contact notification, can I return to work? Ravi, are you able to answer that one for us, please?
So like I said earlier, If you've had a negative result and you are a close contact, you cannot return to work. You still must self-isolate.
Thanks, Ravi. Do I need to document health questions asked of staff, customers and visitors? The answer to that is you need to be doing reasonable checks. So you should be asking your customers, are you suffering from symptoms? Are you required to self-isolate because you've been into close contact with somebody, or somebody from your household or support bubble is currently self-isolating, or you've been to a country where you're required to quarantine afterwards? Whether you document that or not is solely up to you. We would advise you to do so, and I would advise you to make contact with your representative, so you could be part of, example, the National Hair and Beauty Federation. They might be able to assist you in providing you with the forms, and your insurance company may also make that a requirement. If you do need any advice in terms of that, please do feel free to give us a call. That's not a problem at all. I would also recommend that there's a lot of people that I've been talking to in close contact services in relation to this who are actually doing checks 48 hours before and sending paperwork out to you to fill out those details electronically. That's not a problem, but on the day of treatment, you must make sure it's critical for you to also do those simple checks. When I go for my hair appointment on the day of my treatment, my hairdresser will make contact with me via social media. She'll ask me the standard questions. If I answer yes to any of those questions, we'll have a conversation and we'll rearrange the appointment. What should I do if a customer refuses to wear a face covering? As you know, I mentioned to you previously, it is a legal requirement in your setting for customers to comply with the face covering regulations. That is enforced by the police. We are currently doing joint work to those areas which are experiencing non-compliance. You must be asking your questions of those individuals that are not wearing face coverings if they are exempt for medical reasons or have a reasonable excuse. Do these need to be stored physically or electronically? I'm assuming that question's in relation to the health questionnaires. You need to make sure you comply with the GDPR requirements. We will send you a link to the GDPR site with that information during the FAQ document. You need to basically secure them safely. What I would recommend that you do is you have them electronically. It also saves an issue from a infection control point of view. So when people are turning up to your premises and you're asking them to complete the questionnaire, you've got to think about your pens, your papers, cleaning down between uses. You can't clean paperwork, making sure that when you're touching them, you're washing your hands afterwards. So the answer to that would be best practice is to do it electronically. And I think that's all the questions answered so far. Thank you everybody for attending today. I hope you found it useful. We hope that you're settling back in with the reopening launch from the 2nd. Please feel free to contact us if you need support. You will see our guys out and about doing routine patrols in your area. Please feel free to engage with us. Environmental health officers and trading standards officers are currently out doing proactive visits. You will be issued with a COVID compliant sticker as part of our scheme, which will also be uploaded on our council website for compliant businesses. That will also promote your business as being able to signpost to members of the public that you've had your checks and you're trying your best to comply with the restrictions and the COVID close contact guidance. Be safe, be kind, and we hope that you all have a great Christmas and a happy New Year. Thank you.